The meeting of the Health Professions Subcommittee is called to order. Would the clerk call the roll?
Senator Saslow, Senator Newman, Senator Edwards, Senator Lewis, Senator Dunavant, Senator Suderline, Senator Pillion, Senator Barker.
Here.
Mr. Chair, we have a quorum.
All right, is Senator Pillion here, I heard?
He is.
Okay. All right, we have 7 bills before us this morning. There's one person who is chairing a committee. It starts at 9 o'clock on the House side. So I will call on Delegate Corey to present her bill now.
Thank you. Thank you, Chairman Barker. Bill adds the permission for possessing and administering naloxone to the Department of Juvenile Justice employees who are designated as probation and parole officers or juvenile correctional officers. In the code, this group, for some reason, has been left out of
we got a problem here. We can't hear you at the moment. We could hear you just about a little bit ago, but
can you hear me now?
Now I can hear you. Yes.
Sorry, I feel like a commercial. Okay. 1894 adds the employees of the Department of Juvenile Justice who are designated as probation and parole officers or juvenile correctional officers to the list of individuals who may possess and administer naloxone or other opioid antagonist, provided they have completed a training program. This category of employees has been left out of the list of law enforcement officers in the code who have permission to be trained and possess and administer naloxone. That's the bill.
All right. Are there questions of the patron? All right. Do we have anybody who's signed up to speak?
Mr. Chairman, we have one speaker in the queue, Kristen Peterson.
All right. Proceed, Kristen Peterson.
Kristen, please unmute and go ahead whenever you're ready.
Good morning, Mr. Chair, members of the committee. I want to first thank Delegate Corey for agreeing to patron this bill on behalf of the Department of Juvenile Justice. This is indeed an administration bill. I think Delegate Corey has been very articulate in explaining exactly what the bill does, but I'm happy to respond to any additional questions that the committee may have.
All right. Is there any questions of the person representing the Department of Juvenile Justice? All right. The bill is before us. All right. We have a motion and a second. Is there any further discussion? All right. Call the roll. We will vote now.
Senator Saslow, Senator Newman, Senator Edwards, Senator Lewis, Senator Dunavant, Senator Suderline, Senator Pillion, Senator Barker.
Aye.
Ayes 5, no 0.
All right. Thank you.
Thank you,
Certainly.
Mr. Chairman.
Is Delegate Rasool here? Is he in the queue?
Yes, sir, Mr. Chairman.
All right. You have 2 bills. You can take 2039 now and then do 2079.
Yes, sir, Mr. Chairman. Before you is House Bill 2039, which is a product of several stakeholders coming together to work on the scope for physician assistants. Basically what House Bill 2039 does, it would modernize the and advance the PA practice in the Commonwealth to allow for, instead of just partnering with one patient care team, being able to partner with multiple patient care teams. It clarifies that a practice is not limited to the one team. and also ensures that it doesn't mess with any of the educational curriculums that we do have at the same time. Fortunately, the MSV and other partners have come together to find good consensus language, Mr. Chair, and I'm happy to answer any questions.
All right, are there any questions of the patron? All right, is there anybody to speak on this bill?
Yes, Mr. Chairman. First, we have Clark Barano.
All right, proceed, Clark.
Mr. Chairman, members of the committee, Clark Barron of the Medical Society, and we support the bill. We appreciate our friends in VAPUP for putting it in, and Delegate Rasul for carrying it. Thank you.
Next is Sarah Nicely.
Good morning, Mr. Chairman and members of the subcommittee. My name is Sarah Nicely, and I'm the Chair and Program Director of the Radford University Department of PA Studies, and I'm the current President-elect of the Virginia Academy of PAs. We asked Delegate Rasul to carry this legislation as we believe it will help modernize and advance PA practice in Virginia and further our goal of allowing PAs to practice at the top of their license as part of a patient care team. I'd be happy to answer any questions.
There are no more speakers in the queue, Mr. Chair.
All right. Are there any questions of the speakers? All right. The bill is before us. We have a motion to report and a second. Is there any further discussion? All right, please call the roll so we can vote.
Senator Saslaw? Senator Newman?
Aye.
Senator Edwards? Senator Lewis? Senator Donovan? Senator Suderline? Senator Pillion? Senator Barker?
Aye.
Ayes 6, no 0.
All right, that bill will be, we will recommend reporting at the full committee meeting next week. All right, House Bill 2079.
Thank you, Mr. Chair, members of the committee. House Bill 2079 is a consensus bill brought to you from the Joint Commission on Healthcare, which expands modestly expands the scope of pharmacist practices. There are four recommendations that were brought forward by the Joint Commission on Healthcare that would allow this modest expansion that has broad support and a great consensus group that worked throughout the year, including the Board of Pharmacy, Board of Medicine, Pharmacists Association, MSV, and some other stakeholders who believe that this would be a great expansion of some healthcare access here in the Commonwealth. The four things that were laid out were TB testing, certain HIV support, certain devices that they would be able to prescribe, and then the administration of some vaccines. Mr. Chairman, I'm happy to answer any questions.
All right, are there questions for the patron? All right, is there anybody to speak on this bill?
Mr. Chairman, we have Clark Barano back with us.
All right.
Pleasure to be back, Mr. Chairman, members of the committee. We just wanted to thank Delegate Rasul, Jeff Lenardi, and the Joint Healthcare Commission, as well as Senator Donovan, who on the Senate side started this conversation last year. We appreciate everyone coming together and getting peace in the Valley. Thank you.
The only other speaker, Mr. Chair, is Howard Estes.
Okay.
Good morning, Mr. Chairman. Howard Estes on behalf of the Virginia Pharmacists Association. We are delighted to support the expansion of scope and practice for pharmacists. We think this can certainly help with the pandemic and post-pandemic needs in underserved communities and the needs for vaccinations especially. And we are happy to have Delegate Rasul patron this bill and supported the Joint Commission for the practice of pharmacy.
All right, are there questions of the speaker? I do have one. Can you fill us in on the November 1, 2021 date? And I think it's referenced twice in the additional enactment clauses and what that will do.
Yes, Mr. Chair, members of the committee. There are a number of enactment clauses. The first two enactment clauses direct the Board of Pharmacy to develop the necessary protocols and regulations for implementation of this legislation. That will be in collaboration with the Board of Medicine and the Department of Health. And the final enactment clause will direct the stakeholder work group to continue looking at some of the additional ways that pharmacists can be a part of healthcare access.
All right, thank you very much. Are there any further questions? All right, the floor is open. All right, we have a motion and a second to report. Call the roll. If there's no further discussion, we'll call the roll.
Senator Saslaw, Senator Newman, Senator Edwards, Senator Lewis, Senator Donovan, Senator Suderline, Senator Pillion, Senator Barker.
Aye.
7 ayes, noes 0.
All right, that bill will recommend reporting to the full committee next week.
Thank you,
very
Mr.
much.
Chair.
Thank you very much, Delegate Rasool. All right, next up, House Bill 2116, Delegate Mugler.
Morning, Mr. Chairman. How are you?
I'm good. Hope you are too.
Yes, thank you so much, members of the committee and Mr. Chair. I'd like to present on 2116, an amendment in the nature of the substitute, and I believe it is before you.
All right, I guess, is it on the website?
Mr. Chair, good morning. It is available on LIS, and I also emailed it to all of your district emails ahead of the meeting.
Okay, thank you. Does anyone want to make a motion to adopt a substitute? All right, is there a second? All right, we got a motion and a second, so all in favor say aye. All right, all opposed no. The substitute is what's before us now.
Mr. Chairman?
Yes, Senator Suderline.
I need to step away for a few minutes, but we'll still be on site. I don't know how we're doing proxies today, but can I grant my proxy to Senator Newman?
I presume so, yes. I think as long as it's on, you're on site, then
Yep,
I think that.
I will be here and I'll be back soon.
I do
Thank
have
you.
the forms up here, sir.
Okay.
I do have a form.
No, you had, Senator Suderline, that you have to go up there to fill out the form, so. All right, proceed, Delegate Mugler.
Thank you, Mr. Chair. I'll speak first to the actual amendment and then just to the bill intent itself. If you look, there's a strike on line 17. You strike the shall be considered essential workers. And after Chapter 8 of Title 32.1, and then also strike the section related to Section 44 of the code, all lines 21 through 29. So the bill before you is simply a technical bill that clarifies and codifies funeral home personnel in the distribution of PPE and vaccines, and amends the language in Section 32 of the code, adding a section related to the declaration of an emergency related to priority for personal protective equipment and immunization. And this simply seeks to look out for a segment of frontline workers and funeral homes and funeral home personnel that are critical to public health, assures that in the future, should there be a declaration of emergency, that these funeral services will be captured with their protective needs. There is no fiscal impact with this bill. And I would respectfully request, Mr. Chair, that the members of this committee vote to report and advance this substitute. And I'd also like to thank Julia Carlton from DLS for her very swift work on the amendments overnight and into this morning.
All right, thank you. Are there questions of the patron?
Mr. Chairman?
Yes, Senator Edwards.
Did you say you wanted to delete the language from line 21 through 30?
Actually, sir, it's 21 through 29. So line 30 would remain there.
Okay, the emergency clause of line 30 would remain, but 21 through 29 would be deleted, right?
Yes, sir.
Okay.
All right, are there any other questions? Senator Saslaw.
Delegate Mugler, good morning.
Good morning.
You said on line 17, What gets struck?
Shall be considered essential workers.
Why is it? Why are you doing that?
There is nowhere else in the code where essential workers are referred to, and so this just provides a little bit of uniformity.
Okay. Okay. Thank you, Delegate. That's all I have, Mr. Chairman.
All right, are
Yes.
there any other questions? All right, are there speakers on this bill?
There are no hands raised, Mr. Chairman.
I move we recommend favorable reporting to the full
Wait a
committee.
second, Senator Newman has a question, so.
Mr. Chairman, it's really to council, and that is, I know that there are federal designations for what an essential worker is, and I appreciate the fact that the delegate has removed it from the bill, and it certainly would become a pretty big Christmas tree if we didn't. But I guess to council, I know there are federal definitions. Do we go in and define each one of essential workers in the Code of Virginia, or do we rely on the federal definitions?
Mr. Chair, Senator Newman, I do not believe that we go in and define each essential worker in the code. No.
Mr. Chairman.
Yes.
I guess I really appreciate the delegate's substitute, because I think if we did this, before you know it, every group will come before us, and I think the subcommittee probably should be very careful about going down that path, because it would be a way around some of the federal designations. So, Mr. Chairman, unless there are others, I would move that we report, or we recommend a report to substitute as amended.
All right, we have a motion to recommend reporting the substitute. Is there a second? All right, a motion and a second. Is there any further discussion or questions? All right. Call the roll.
Senator Saslow? Senator Newman? Senator Edwards? Senator Lewis? Senator Donovan? Senator Suderline by proxy? Senator Pillion? Senator Barker?
Aye.
Ayes 8, no 0.
All right, we will recommend reporting to the full committee next week.
Thank you so much, Mr. Chair and members of the committee.
Right, welcome. All right, next up is Delegate Hayes, House Bill 2220.
Thank you, and good morning, Mr. Chairman and members of the committee. Good morning.
Good morning.
Properly before you this morning is House Bill 2220, a measure that will protect the public and fulfill the Department of Health Professions' recommendation to certify the profession of surgical technologist. The bill provides that no person shall hold himself out to be a surgical technologist or or assume the title of surgical technologist or certified surgical technologist unless this person is certified by the Board of Medicine. Currently, a person must be registered with the Board of Medicine, and the bill also adds a requirement that an applicant whose certification is based on his or her holding a current credential as a certified technologist from the National Board of Surgical Technology and Surgical Assisting also demonstrate that the individual has successfully completed an accredited surgical technologist training program. It also provides that the Board of Medicine may certify a person who has practiced surgical technology 6 months prior to the enactment of this bill. I hope it's the wishes of the committee to act favorably upon the bill. Thank you, Mr. Chairman.
All right, are there any questions of the patron? All right, is there anyone to speak on this measure?
Mr. Chairman, we have Hunter Jamerson being moved into the room.
All right. Mr. Jamerson, you can speak now.
Mr. Chairman, his Zoom does not seem to be working very smoothly, but I will let you know when he's on.
All right, thank you. And is that the only person to speak?
Yes, sir.
Okay. All right, is there any discussion or questions? Any luck getting him on?
Mr. Chairman, he is now connected. He should be ready to go.
All right.
Good morning, Mr. Chairman. Technical difficulties in the snow. Hunter Jamerson on behalf of the Association of Surgical Technology and the Virginia Commonwealth Association of Surgical Technology. I appreciate Delegate Hayes bringing this bill. We're in full support of this bill. Bill protects all current individuals performing the duties of a surgical technologist, but as Delegate Hayes noted, the bill does bring us into conformity with the Department of Health Professions recommendations for the certification of this profession, and we will henceforth protect the title of surgical technologist on the basis of the criteria recommended by the Department of Health Professions. I ask that you support the bill. Thank you.
All right. Are there any questions of the speaker?
Mr. Chairman?
Yes, Senator Edwards.
Just an observation. It used to be there were doctors and nurses, period. Now there's PAs, they're nurse practitioners, they're certified technologists of different kinds. This is a new concept to me, certified surgical technologist. That's where, how many different categories are there in the field of medicine? Does anybody know? It's a curious question.
All right. I do not know, but there are quite a few. There's no question about that. And we've had some that are licensed, others where there's certification but not a licensure category, some where you can basically only certain people can call themselves a particular profession, which is actually what happened to this initially, this bill, which I had carried a few years ago. Basically what it did initially was just to say that no one could classify themselves as a registered surgical technologist unless they met certain requirements. So this is just moving things forward, and this is not an unusual path that you have a category of personnel that initially get a sort of a small step as to what they can call themselves and then eventually move towards certification and sometimes licensure. So there are a lot in it, and it's partly just sort of the specialization of medical care has increased substantially and actually provides a lot of benefits. Any other questions or comments? All right, the floor is open. All right, we have a motion to recommend reporting to the full committee and a second to that motion. Any discussion? All right, call the roll on that motion.
Senator Sasslaw, Senator Newman, Senator Edwards, Senator Lewis, Senator Donovan, Senator Suderline by proxy, Senator Pillion, Senator Barker.
Aye.
Ayes 8, no 0.
All right, thank you. All right, and then now we have two bills from Delegate Adams. First one is House Bill 1747.
Good morning, Mr. Chair and members of the committee.
You may proceed and present 1747.
Okay. I'm just pulling up my other bill. Thank you, sir. Can you hear me okay?
Yes.
Thank you, sir. All right. HB 1747 is a bill that would license clinical nurse specialists under the Joint Boards of Nursing and Medicine. Clinical nurse specialists are among the 4 types of advanced practice nurses and the only not jointly regulated at this time. Clinical nurse specialists have been recognized as advanced practice nurses since the early 70s. Beginning about 20 years ago, graduate programs preparing clinical nurse specialists also incorporated components into their educational programs, such as the skills of diagnosis and pharmacologic management of patients. So while these clinical nurse specialists are educated and trained to diagnose and treat pharmacologically, in Virginia, they are unable to do so because they are regulated solely on the board, under the Board of Nursing. For those clinical specialists who have attained the additional skills of diagnosis and pharmacologic management, this would enable them to obtain prescriptive authority as part of their collaborative practice with physicians. This will add providers to the health professions workforce that, working to the full extent of their education and practice. This bill maintains collaborative practice agreements for clinical nurse specialists as a condition of practice. It simply aligns the regulation of the specialty with the education and training for these practitioners have received. This bill will grandfather in licensure of clinical nurse specialists who are currently registered under the Board of Nursing. However, this grandfathering will not automatically convey prescriptive authority to existing clinical nurse specialists. Only those who meet the additional requirements for prescriptive authority would be able to apply for prescriptive authority going forward. This bill is a modest approach to help expand the workforce and allow clinical nurse specialists to practice within their education and training. I'm aware of no opposition to this legislation and its common sense measures to allow clinical nurse specialists to contribute fully to patient care teams. Thank you, Mr. Chair.
All right. Are there questions of the patron? All right. Do we have anyone to speak on this?
Mr. Chairman, just a comment.
Yes, Senator Donovan.
There are 4 advanced practice nurses licensed in the state of Virginia, and clinical nurse specialists are the only ones that for some reason don't have prescriptive authority, but they have the same training. And so I think this makes sense, and I'll move that we recommend and report it.
All right. Do we have any speakers yet?
Mr. Chairman, we have a number of speakers in the queue.
All right, let's take them first, and then we'll handle the motion afterwards.
First, we have Cynthia Ward. Please unmute and go ahead.
Good morning. Thank you. I'm the current president of the Virginia Association of Clinical Nurse Specialists, and we'd like to thank Delegate Adams for being the patron for this bill for us. We are requesting licensure under the joint boards and the ability to apply for prescriptive authority that will increase access to care for Virginians and allow us to positively impact disease management in collaboration with other APRNs and physicians. And we respectfully ask that you advance this bill.
Thank you.
Next, we have Becky Bowers.
All right.
Good morning, Mr. Chairman, members of the committee. I have
morning.
nothing more. Good to see you. I have nothing more to say. I'm looking forward to Senator Donovan being able to raise her motion to move this bill forward, and appreciate the work that Delegate Adams has done for us. Thank you.
Thank you.
Kay Butler.
Good morning, Delegate Dawn Adams. Thank you very much for your support of this bill, HB 1747. Good morning to Mr. Chairman and the members of the committee. Time and time again, nursing has stepped up to the plate to meet the needs of our community. We are asking you now to support this bill. Thank you.
All right.
Clark Barano.
Good morning once again, Mr. Chairman, members of the committee, Clark Barron with the Medical Society, and we support the bill.
All right. Any questions of the patron? The speaker? All right. Next speaker.
Wendy Greenwood.
Good morning. I'd like to thank you first for the bipartisan support that you have all shown to us healthcare providers in the field, giving us access to so many supportive measures during the pandemic. That has been huge. I'm also here to ask for your support for House Bill 1747. I am an example of one of the nurses that this would affect. I've been a nurse for 24 years in the Commonwealth of Virginia with a background in emergency medicine, OR PACU, and I lead our resuscitation teams. I'm a brand new graduate from a clinical nurse specialist program and eligible to take the boards. With this type of bill in place, then I can also work with our physician champions to help bring in better care for our patients in a more timely and efficient manner. So I ask for your support for this bill, and I thank you for your time.
Thank you.
Lilia Keys.
Good morning. Can you see me? Okay, am I on? Let me see. Hello, this is Lil Keys. Can you see me?
We don't see you, but we hear you.
Okay, well, listen. Hi, thank you very much, Chairman Barker and members of the committee. My name is Lilia Keys. I live in Northern Virginia, and I am representing AARP in Virginia. We certainly support Bill 1747. And we just think this is a wonderful thing for all those hardworking nurses who put their lives on the line all the time. Thank you very much for your time.
Thank you.
Andrew Lamar, please go ahead.
Good morning, Mr. Chairman and members of the committee. On behalf of the Virginia Nurses Association, strongly support the bill and thank you for your help, Delegate Adams.
And Mr. Chairman, the final hand raised is from Sarah Taylor.
All right.
Good morning, Chairman and committee. I'm very happy to speak with you this morning. I again am a CNS with several years of emergency medicine practice. This is going to broaden how many patients and constituents in Virginia that I can provide care to. I am imploring you, please support this bill. Thank you.
Thank you. That's all the speakers, I presume? All right, thank you. We have all the speakers that have signed up. So the bill is now before us. And Senator Donovan, did you want to make a motion?
Yes, thank you, Mr. Chairman. I move that we recommend reporting.
All right, is there a second? Is there any discussion on the bill? Yeah, we got a second. Was there any discussion on the bill? All right, call the roll, please.
Senator Saslaw, Senator Newman,
Aye.
Senator Edwards, Senator Lewis, Senator Donovan, Senator Suderline, Senator Pillion. My apologies, sir. What was? Yes, sir. Senator Barker?
Aye.
Ayes 8, no 0.
All right, and next we have House Bill 1988, also patroned by Delegate Adams.
Thank you, Mr. Chair. And I believe there is a Senate substitute.
Mr. Chair, the substitute is available on LIS and was also emailed ahead of the meeting.
Okay.
Mr. Chair, should I explain the bill or the substitute first, or both?
Explain the substitute and anything significant in terms of the difference between that and what passed the House.
Yes, sir. The substitute is basically an add back in. We had taken out a section that specifically had to do with ensuring medical cannabis for patients that are in particular facilities, such as nursing homes, hospice, and similar environments. However, nursing homes needed to be pulled out, and then we inadvertently did not put back in the section around allowing designated caregiver facility to include the hospice facility or home care organization. So that is added back in through the substitute. The larger bill is a number of technical changes to the overall medical cannabis program. As we are moving closer to the possibility of adult use recreational cannabis program in Virginia, it's critically important that we continue to support the medical cannabis program to ensure patients have access to the necessary medical care and are supported by qualified healthcare providers. Each of the changes outlined in this bill reflect lessons learned from our experience with the program to date and seek to ensure that all patients have access to quality, affordable care, make operations more efficient and reduce waste, ultimately reducing cost to patients, clarify that the laws relating to the relationship between the pharmaceutical processors and the pharmacists provide additional guidelines for informing and advertising to patients. The key changes include ensuring that providers hold sufficient education and training to exercise appropriate professional judgment in the certification of patients, removing the arbitrary cap per registered practitioner that restricts a clinician's ability to treat patients and interferes with the patient-provider relationship, expanding medical cannabis access for those who are unable to physically access physicians or dispensaries due to disability, location, or other concerns, including telemedicine services, allowing secure transfer of product between cannabis dispensing facilities, allowing for remediation of cannabis oil after testing rather than requiring automatic disposal, aligning regulations with typical pharmacy practices by providing for annual routine inspections instead of the previously required quarterly inspections, allowing processors to use third-party background checks that disclosed any federal or state criminal convictions, requires that the pharmacist personally supervise only the dispensary and cannabis dispensing facilities, which is most in line with their training to assist patients with access to their medicine, allows other trained professionals to oversee areas completely out of the realm of the pharmacist training, including cultivation, extraction, and processing, and moves overall facility responsibility from the pharmacist in charge to the pharmaceutical processor as a licensed entity. The processor itself should be responsible for paying fines, meeting sanctions, etc., not the pharmacist. Streamlining these operations will lower out-of-pocket costs and secure patient access to medically necessary care regardless of ability or location. The bill ensures that the medical cannabis program is sustainable in the long term and able to continue improving upon its service to patients. And I thank you, Mr. Chair.
All right, are there questions of the patron? All right, are there speakers signed up for this bill?
Mr. Chairman, there are a number of speakers in the queue.
All right, can we start with those that are supporters?
Ellie Tucker, please unmute and go ahead.
Good morning. My name is Ellie Tucker. Thank you, Delegate Adams, and thank you all for taking comment. I am a medical cannabis patient. Please keep the telemedicine option in this bill. For some of us seniors, it is too far to go to get a medical recommendation, and now we have snow to contend with too. Thank you for letting me speak.
Thank you.
Next, we have Hunter Jamerson.
Good morning again, Mr. Chairman, members of the subcommittee. Hunter Jamerson. I'm representing Jushi. Jushi is the pharmaceutical processor that operates the Delizzo medical cannabis facility in Manassas and services Health Service Area 2, the Northern Virginia Health Service Area. I'm grateful for Delegate Adams bringing this bill. I'd be remiss to not note to the subcommittee just the level of effort Delegate Adams has put into not only this bill, but this issue generally. I deign to say there's not a practitioner in Virginia who has learned more about medical cannabis than Delegate Adams, and very grateful for that, particularly grateful that she's taken the time to visit each of the medical processors operating in the state. I think she has a tremendously unique perspective on our operational needs and considerations, and most importantly, the changes necessary in the program to ensure patient access, as you've just heard, as well as patient affordability, because this medical program is very important. The subcommittee spent a lot of time to help develop this medical program, particularly several of the members who have exhaustively worked towards this. Each year, I think the program has gotten better. This bill, I think this helps the program get even better. We've worked painstakingly with the Department of Health Professions and the Board of Pharmacy to find solutions to each of the challenges we're facing operationally. I think I'm comfortable in saying we have reached consensus on all points except for maybe how to handle telemedicine. And I'll sum up, Mr. Chairman, by just summarizing to say the bill does two really important things. Pharmacists can't get medical malpractice insurance to go into the cultivation lab and watch the plants grow, or to supervise the wood chipper as waste materials being discarded. So this change to limit the pharmacist responsibility to where they naturally are within the scope of practice in the dispensary is very important to protect the pharmacists, and you'll hear from some of the pharmacists who work for the medical processors today. Also, I wanted to emphasize the importance of the telemedicine changes we're making, which is really to allow our hospice patients or assisted living patients right now who can't access a delivery or travel out to the pharmaceutical processor because of COVID, because of other healthcare restrictions, to ensure that they have direct access to a certifying practitioner. This in no way changes the need for a practitioner to issue a certification, for there to be medical necessity, for the standard of care to be followed, but it ensures that patients who physically can't get to the practitioner or to the processor can still access the medications they need. So we ask for your support of Delegate Adams' substitute today. Thank you.
Thank you. Next.
Tamara Netzel. Tamara, please unmute and go ahead.
Hi, good morning. We'd like to thank Delegate Adams for this bill. My name is Tamara Netzel, and I am a medical cannabis, a Virginia medical cannabis patient. I also represent hundreds of Virginia medical cannabis patients who would really like to see the telemedicine piece of this program just stay, because there are many that depend on this telemedicine, because there are already so many barriers to the program that telemedicine alleviates. And so I would like to see, on behalf of Virginia medical cannabis patients, the telemedicine piece to stay. Thank you.
Thank you.
Lisa Smith, whenever you're ready.
Hi, good morning, Mr. Chairman and Senators. I'm Lisa Smith. My daughter Haley is a patient in the medical cannabis program. I'm here supporting HB 1988. In particular, the ability to access telehealth for the initial consultations is important for families like mine, where travel can be difficult when you're dealing with a disabled child and all the multiple things that go along with that. And for me, I live in a rural area, so the closest practitioners are well over an hour in one way to get to, and I have to travel a far distance. I participated in the medical cannabis working group last year and spoke to the challenges that the telemedicine alleviated for families like mine and other families in nursing homes, hospices, and everything. And we spoke to the Board of Pharmacy about the challenges in these discussions. This bill improves patient access, and I hope that you will pass it. Thank you.
Thank you.
Jennifer Stringer.
Good morning. Thank you, Delegate Adams, for supporting this bill. I am a Virginia medical cannabis patient. My chronic illnesses have taken away my independence, my ability to drive, and the access to the practitioners and the dispensaries through, or the pharmacists and the dispensaries through telemedicine has helped me manage some of the most debilitating pain that I've ever experienced. So I appreciate all of the work that you've been doing. And as an additional supporting measure is that my chronic illness has put me at higher risk for COVID. So my ability to renew my my license or my certification through telehealth is helping me as of today to be able to renew that, to have access to my medication. Thank you very much for your work.
Thank you.
Neist, please go ahead.
Hi, apologies. My name is Nigas Debebi, and I'm the Director of Public Policy for Columbia Care, and here to also speak on behalf of the Virginia Medical Cannabis Coalition. I want to echo the thanks to Delegate Adams for her diligent support of the medical cannabis program and her deep knowledge of this, both as a medical professional and a policymaker. In addition to the points that Hunter Jamerson raised earlier about the pharmacist delegation, I would like to just remind the committee of the unique process patients have to go through in order to participate in the medical cannabis program. A patient must first find a practitioner registered with the Board of Pharmacy to certify patients for medical cannabis. According to the most recent numbers from the Board of Pharmacy, that practitioner list is just over 500. And based off of the Department of Health Professions data, there are 380,000 licensed medical practitioners in Virginia, which means only 0.1% of medical practitioners in the state are able to recommend a patient, which is greatly limiting access to this medicine. And though many patients seek out and work with primary care providers who approve of their medical cannabis use, even practitioners who approve of medical cannabis might not be able to issue certifications due to hospital policies or other bureaucratic limitations. And so it is really important, I think, that we ensure that telehealth is available for those practitioners that are able to certify, because they help patients maintain their continuum of care and ensure that they have access to medicine that they and their primary care providers are seeking out for them. We have, with the COVID public health emergency, some of the previous telehealth standards have been waived, and we're asking to allow the current telehealth standards in place under the public emergency to have a permanent solution to address this patient access. I'll just also add that medical cannabis is logged in the PMP, and the Board of Pharmacy tracks the number of certifications issued per practitioner. And so rather than create new burdens on patients, we would just like to let the Board of Pharmacy use their existing tracking and enforcement tools to monitor public safety and improve patient access to the medical cannabis program by expanding telehealth standards.
All right, thank you.
Thank you.
Next.
Next is Melanie Davis.
And could the speakers try to limit themselves to about 2 minutes in presentation so we can move along?
Good morning. Mine will be much less than 2 minutes, I promise. Good morning, Mr. Chairman and committee members. My name is Melanie. I'm an ER nurse from Hampton, but most importantly, I'm Aiden and Madison's mom. My 11-year-old daughter, Madison, took up to 5 cannabis medications at incredibly high doses for over 4 years after standard treatments failed her in her battle against brain cancer. Due to the weakness and incomplete nature of our current laws, we were forced to obtain her cannabis care and medicine from the other side of the country, untested, uncertified, unreliable, and unsustainably expensive. Those medicines helped her live a life full of joy, love, beauty, and adventure, and free of pain, seizures, nausea, and vomiting. From the depths of devastation, I share that she died in her room at home and in our arms on May 11th, 2020. In her priceless last days, weeks, and even months with us, having to travel absolutely any distance to meet with a provider or pharmacist to obtain the medicine that was not saving her life, but giving her a reason to keep living, would have been a physical and safety impossibility. Now is the time for life-savingly vital and long overdue common sense changes to our cannabis laws that include the possibility of telehealth visits. In Madison's honor and for the countless other children and adults still fighting for their lives, please stand on the right side of this issue and vote to support House Bill 1988. Thank you.
All right.
Michael, please unmute and begin.
Good morning, Mr. Chair and members of the committee. Thank you, Delegate Adams, for bringing this forward. My name is Michael Johnson, and I'm the pharmacist in charge of Darba Pharmaceuticals. Sorry, Melody's testimony kind of got me there. And it's things like that that make this bill so important. It truly is amazing what can happen from this. I support Bill 1988, and in particular, the provisions of the bill clarifying the role of the pharmacist in our facilities. The care for our patients is our utmost concern, and we truly believe medical cannabis is medicine. Under 1988, pharmacists such as myself will remain fully responsible for our dispensing areas and cannabis dispensing facilities, just like a pharmacy. What we are changing is that a pharmacist would no longer need to personally supervise cultivation, disposal, extraction, and processing of plants. Pharmacists are not trained in the growing and processing of plant materials. Our facilities require 24/7 surveillance, and anywhere cannabis and every part of cannabis is required to be overseen by appropriate experts. We have horticulturists, chemists, and likewise, we have pharmacists in our dispensing facilities. We need to not have pharmacists in our extraction lab or our cultivation area. We need to be with patients. We have to submit to GMP compliancy, which, if you have not been part of that, is pretty extreme. I'm asking you to support 1988 so that my fellow pharmacist and I can be with patients and not with plants. Thank you.
Thank you. Are there other speakers?
We have 3 remaining speakers.
Okay.
Next is Julia Hammond.
Okay.
Good morning, Julia Hammond on behalf of the Virginia Assisted Living Association. We strongly support the bill and we thank the patron for bringing forth a solution that helps residents of assisted living facilities to be able to get this very important medical cannabis. Thanks so much.
Thank you.
Garrett Vogel.
Hi, yes, my name is Garrett Vogel. I am a chronic pain patient, and I have found that with my medical conditions, being able to just make it out of bed some days is pretty much impossible. And with this telemedicine, it'll help people who are like me and worse than me, who are not able to always count on being like, oh, Wednesday is going to be a good day, so I'll have the appointment for that day, but be able to have it more open up to how their needs need to be met. And so I am just speaking out in favor of this bill, and really hope it passes, because I think it can really help a lot of people that really need the help of cannabis. But transportation is a big problem, especially now with COVID. So thank you very much.
Thank you.
Amy Flick.
Can you hear me?
Yes.
Okay, I'm Amy Flick. I'm a cannabis patient, and I'm just asking you to keep the telehealth. I'm currently disabled and driving. It takes me, it's a round trip of over 4 hours just to get to the dispensary, and keeping the telehealth lets me communicate with the pharmacist, and also let me get my card, which wouldn't have happened without telehealth, as I can't sit, stand, or anything for over 20 minutes. So if you would support the bill, I would greatly, greatly appreciate it. Thank you.
All right, thank you. Is that all the speakers?
Mr. Chairman, there are still additional people currently who have just raised their hands, but those are all that are in the panel right now.
All right.
I don't know if you want
well, if they've raised their hands, let's try to get them on, and we'll limit them to 2 minutes per speaker. So,
Jen Padini, please unmute and go ahead.
Thank you. Good morning, Mr. Chairman, members of the committee. Jen Michelle Padini on behalf of the National Organization for the Reform of Marijuana Laws. I also served on the medical cannabis work group, which one of the primary objectives was to address telemedicine limitations previously imposed on this program. While the executive order is fortunately providing an interim solution, rolling back these current provisions post-pandemic and again restricting patient access to certifying clinicians would in no way provide for increased patient safety, and would continue to reserve this program for only those patients who are financially and or physically able to visit clinicians in person. We'd like to thank Delegate Adams for her thoughtful work on addressing patient concerns, and I will echo the sentiments of Ms. Abebe, Mr. Jamerson, Mr. Johnson, and the many patients who voiced their concerns retaining access to telehealth and reducing operational costs. Thank you.
All right, thank you.
Lastly, we have Vicki Williams.
All right.
Good morning, Mr. Chair and the members of the committee. I'd like to thank you so much for supporting this. I ask that you support HB 1988. I am a medical cannabis patient as well as an advocate. I certainly do support opening telehealth, making sure that is available. As someone who is a cancer survivor, having had chemo, I know intimately the dangers of being out there in the community when you are immune compromised. Also, I wanted to point out that many primary care providers support medical cannabis, but are unable to recommend it due to hospital or other policies. Thank you so much for giving me this time, and I urge you to support this bill.
All right, thank you. Is that it? Okay, that's all the speakers. Are there any comments from members of the committee? All right, I think we skipped the adoption of the substitute when we got that presented to us. So is there a motion on adopting the substitute? So we do that. All right, we have a motion. Is there a second? All right, we have a motion and a second. All in favor say aye. All opposed, no. Okay, the substitute is what's before us now. Are there any, so the floor is open. All right, we have a motion to
Mr.
report
Chairman,
the substitute. Yes, Senator.
Speak to that motion. I will say, I know we've heard a lot of speakers, and there are still some that have not had the chance to speak. I don't know if that was a decision or just confusion with the Zoom. But I just want to point out, I know there's been some assaults on the telemedicine component of this bill.
Right.
And when telemedicine was unleashed because of COVID, there was a great epiphany about how it could really be instrumental in medicine, and this is just one more example. And so I'm very supportive of keeping the amendment as it is and making telemedicine available. And I just want to assert that as we go forward, because I don't know if that battle's done, but this is really important. So I'm very much in favor, and I'll second the motion if it's been made to recommend report.
So we have a motion and a second to recommend reporting of the bill. Is there any further discussion? We already have a motion to recommend reporting. Okay. All right. If there's no further discussion, call the roll.
Senator Sislo, Senator Newman, Senator Edwards, Senator Lewis, Senator Donovan, Senator Suderline, Senator Pillion, Senator Barker.
Aye.
Ayes 8, no 0.
All right. We have dealt with all our bills. If there's nothing further on the agenda, so we will adjourn now. Thank you.
Mr. Chair.